Good afternoon. Joining me today from the Maryland Department of Health, our Deputy Secretary for Public Health Services, Dr. Jinlene Chan, and Assistant Secretary Brian Morose. As we battle the fall surge of COVID-19, one of our highest priorities continues to be securing additional relief for families and small businesses. Yesterday, a group of governors joined with me and again strongly urging leaders of Congress to immediately act on a COVID-19 relief package. Many CARES Act programs, including the Paycheck Protection Program, have already run out, and many more critical programs are set to expire by the end of this month. So many of our families and small businesses are hanging on by a thread, and it would be unconscionable for Congress to cut their lifeline right now. We recognize that there are legitimate differences of opinion on what the amount of relief should be and what the package should contain. But these differences pale in comparison to the cost of doing nothing. We don't have time for any more excuses, delays, or any more partisan political gamesmanship. Congress simply must come together to take action now on a bipartisan compromise relief bill. Back in February, I said that I was confident that our state would be a national leader in developing treatments and perhaps even a vaccine for COVID-19. Researchers at the University of Maryland Medical Center were the first in the United States to begin testing Pfizer's vaccine. Novavax of Montgomery County is about to begin phase 3 trials on their vaccine. And Emergent Biosolutions, which is headquartered here and has 6 sites in Maryland with nearly 1,500 employees, is manufacturing vaccines for both AstraZeneca and Johnson & Johnson. Nearly 40 Maryland companies have been working on developing and manufacturing COVID-19 vaccines and innovative therapeutics. Our team at the Maryland Department of Health has worked very hard over the past 8 months preparing plans to procure, distribute, and administer COVID-19 vaccines when they became available. Our vaccination plan was submitted to the CDC back in October, and in November, we committed to an additional investment of $10 million for the acquisition of a strategic stockpile of syringes and other necessary supplies for the vaccine. We have had regular meetings with the White House Coronavirus Task Force and the leaders of Operation Warp Speed, and we've been working very closely with our hospital systems and all of our local jurisdictions in order to be prepared for the initial distributions of the vaccine. To be effective, these vaccines need to reach a vast majority of our population, and to do so in a relatively short period of time. This is by far the most massive undertaking of this pandemic. In order to further prepare our state and to ensure that we are ready to distribute the vaccine widely, today the Maryland Department of Health has issued an order which expands the scope of practice for licensed providers so that any healthcare professional, including all doctors, nurses, paramedics, and pharmacists, will be able to administer COVID-19 vaccines with appropriate training and under proper supervision. Today's order also provides that healthcare providers who are already capable of performing vaccinations may prepare and administer COVID-19 vaccines at state-designated vaccination sites. To help demonstrate confidence in the safety of the vaccine, I want to make it clear that Lieutenant Governor Rutherford and I will both take the vaccine in public as soon as it becomes available to us. And we will be leading an aggressive statewide public health campaign urging all Marylanders to get vaccinated. While the delivery of vaccines is very welcome news, I would caution Marylanders to remember that our initial allocation will only be 155,000 doses of the vaccine, with the possibility of perhaps up to 300,000 by year's end. It's often said that it's always darkest before dawn. Right now, we do remain in a better position than many other states, with the 8th best positivity rate in the nation, the 9th best case rate, and we are the 4th best mask-wearing state in the nation, with 96.7% compliance. However, in spite of all that success, it is clear that our worst days of this pandemic are still yet to come in the weeks and months ahead. On Friday, we hit a daily record for confirmed cases. We've now had 35 straight days with more than 1,000 cases. Maryland's 7-day statewide positivity rate is 7.61%, and our cases per 100,000 is now at 44.8. The death toll continues to climb. The United States is now losing one person to COVID-19 every 30 seconds or less. The virus has taken the lives of over 283,000 Americans, including 4,755 Marylanders. And today, for the first time since May 22nd, we reported more than 50 deaths in a single day. 1,653 COVID patients are hospitalized today in Maryland, which is the highest level since May 9th. 396 Marylanders are currently in intensive care units, which is the highest level since June 7th. 85% of our staffed acute beds in the state are occupied, and 87% of our ICU beds are occupied. 142 surge beds are currently in use at the Baltimore Convention Center Field Hospital, the reopened Laurel Hospital, and the expanded Washington Adventist Hospital, all of which we added this spring. We have now activated our Critical Care Coordination Center that allows us to shift patients between hospitals. It has already resulted in the successful placement or movement of 38 patients among 18 different hospitals. We have received an enthusiastic response to our call for medical staffing surge. In the first week since I announced it, 4,268 prospects have signed up to work at our hospitals, nursing homes, testing sites, and vaccination clinics. Anyone interested in these positions can go to www.marylandmednow.com. An additional 576 volunteers joined from our Maryland Responds Medical Reserve Corps, which has now a total of 15,908 people signed up. More than 1.2 million Marylanders have subscribed to our MD COVID Alert contact tracing app since it launched, which, according to Google, gives our state #1 adoption rate in the nation. We are encouraging everyone to opt in to help allow us to stop the spread and protect our fellow Marylanders. Lastly, we are monitoring active cases at 190 nursing homes and at 132 assisted living facilities. Nursing homes cases remain higher than during the initial spring outbreak. The cavalry is coming. A vaccine is on the way, but it is absolutely critical that we continue to fight this virus with everything we've got, and we all need to keep doing the things that we know will help keep us safe. To provide an overview of our plan for the initial rollout of the vaccine in Maryland, I'm now going to turn it over to Deputy Secretary Chan and Assistant Secretary Morose.
Thank you, Governor. We are pleased to be here with you this afternoon to give more details about our plans to roll out COVID-19 vaccination in Maryland. Since early in the pandemic, we knew that having a safe and effective vaccine would be an important tool to help us save lives. Just as we in Maryland have been working around the clock to respond to the COVID-19 pandemic through testing, contact tracing, expanding our hospital surge capacity, PPE, and multitude of other response efforts. We know that scientists and researchers around the world and here in the United States and even here in Maryland have been working also around the clock to develop and test a vaccine through our phase 1, 2, and 3 clinical trials. Now, the early data from the first 2 vaccines being considered in the United States have shown a high level of effectiveness in preventing disease from COVID-19, and most people involved in the clinical trials have reported minimal side effects. COVID-19 vaccination implementation will continue to evolve in concert with our federal partners and vaccine manufacturers, and we will share more information as we have it. What we will discuss today is the information that we have to date based on the planning that we have been doing over many months. And I want to currently, right now, turn it over to Brian Morose to speak to some of our planning work.
Thank you, Dr. Chan. Thank you, Governor, for giving me the opportunity to discuss this important initiative. Our planning and preparation, along in Maryland as well as in the federal government, started when the pandemic began. As early as April, Maryland Department of Health began developing vaccination plans. By mid-October, Maryland had submitted our COVID mass vaccination plan to the CDC. In October, we also started to secure supplies that we knew would be needed for the mass vaccination effort. In November, we began convening our advisory groups, technical, minority health, vulnerable populations, and other outreach groups. Also in November, Governor Hogan announced a $10 million in additional funding to secure ancillary supplies such as syringes, personal protective equipment, and freezers. These are just a few of the ways in which Maryland has been preparing for the vaccine. Preparations were also occurring on the national level. Multiple pharmaceutical companies began developing vaccines and conducting trials months ago. Clinical trials occur in 3 phases, and in the last phase, tens of thousands of volunteers are involved. Once a vaccine candidate has demonstrated a high level of efficacy and safety, the pharmaceutical companies can then apply to the federal government for an emergency use authorization. So far, only 2 pharmaceutical manufacturers have applied for this emergency use authorization. Currently, these 2 companies are manufacturing millions of doses in anticipation of federal approval. The federal government has already prioritized these allocations for delivery across the United States. Once approved, these allocations will be shipped directly to the providers such as hospitals, pharmacies, and clinics. In addition to distributing the vaccines, the federal government is shipping the ancillary supplies associated with vaccine administration. This entire development distribution process is monitored and assessed by the FDA and the CDC to maximize security. With security, safety, and efficacy in mind, I want to bring Dr. Chan back up to discuss the 2 vaccine candidates that have applied for emergency use authorization.
Thank you, Brian. So, as you've heard, there are 2 candidates. The first one is from Pfizer. Some of the early data that they released in early November from their phase 3 clinical trials suggests that there is between 94 to 95% efficacy in the risk of disease occurrence among people who got the vaccine compared to people who did not get the vaccine or who got the placebo. And this also was highly effective even among individuals who were older. And this The results were after the second dose, and both vaccines require 2 doses for maximum efficacy. It is important to note that in some of the early information provided by Pfizer, that even in preventing severe disease, it is closer to 100%. Again, ongoing information and tracking of individuals who've participated in the trials will continue to identify potential side effects as well as clinical outcomes. Pfizer submitted on November 20th their application to FDA for an EUA approval, and later this week, on December 10th, the FDA's advisory committee will be considering the data and make a recommendation to the FDA on whether to approve or not. In the time frame since Pfizer submitted their application, the FDA has been carefully considering the data that has been submitted. And so our FDA's process in considering any vaccine application is that they independently analyze the data that is submitted to them by the vaccine manufacturer coming out of all the clinical trials, so that they can make an independent determination not only about efficacy, but also about side effects and other impacts within the volunteers who participated in the trials. If approved, which we anticipate it will be, we believe that the initial doses of the Pfizer vaccine will become available for Maryland as early as the week of December 14th or next week. Now, Moderna is the second vaccine that has submitted their application to the FDA for EUA approval. Early data that Moderna has released shows that it also has similar efficacy to the Pfizer vaccine with about 94% efficacy. They applied on November 30th, and the FDA's advisory committee has already scheduled a meeting to consider their vaccine data on December 17th, with the anticipation that if approved, then the week after, on the week of December 22nd, that Maryland will be able to receive the Moderna vaccine for use. So, as Maryland has considered how to best allocate the initial vaccine doses, we're taking into account a number of key priority considerations. First, our federal recommendations. With our federal partners, CDC just last week, their advisory committee on immunization practices on Tuesday released their initial recommendations for the priority grouping for Phase 1A to include healthcare workers and residents of long-term care facilities. Long-term care facilities would include both nursing homes as well as assisted livings. We have also considered the groups at highest risk for complications or death from COVID-19 disease. And as many people know, and as the governor has indicated, nearly half of our deaths have occurred in individuals in nursing homes, and we currently have 190 active outbreaks in nursing homes and over 130 in assisted living. So these are among the highest risk groups in Maryland. It is also critical that we preserve our healthcare capacity, and that has been an important consideration the entire course of the pandemic. And more recently, we've issued a number of orders and guidance documents with the intent of maximizing our ability to deploy our critical healthcare infrastructure and to maintain it, to be able to care not only for individuals with COVID-19, but people who come to seek healthcare for other conditions, whether in the hospital or in outpatient settings. So, as seen in this graphic, our approach in Maryland will be to include in that Phase 1A all healthcare workers, long-term care facility staff and residents, as well as first responders. That will include nursing homes as well as assisted livings, where we have had, as we've mentioned, a significant impact. As we receive more vaccine in the weeks and the months to come, we will continue to expand the groups who are able to access vaccine, including people in high-risk categories for severe COVID-19, such as those with chronic pulmonary disease, chronic kidney disease, or heart conditions, and also adults in other congregate settings. As we ramp up our vaccination program, we will move quickly into phase 2, which will include people who work in other critical essential infrastructure settings and be able to open vaccination up for them. And ultimately, our goal in Maryland is to make sure that COVID-19 vaccine is available for every Marylander who wishes to have it. So as we approach phase 1, we will be focusing primarily on the vaccination of the high-risk populations, again, in alignment with the federal guidance. We anticipate that after the FDA approves each of the vaccines, that the CDC's Advisory Committee on Immunization Practices will reconvene to provide additional guidance that may be specific to the Pfizer and Moderna vaccines based on the detailed data analysis that they will have done. The CDC will provide us with information as we go forward on the number of doses that we'll have available week after week. And while we expect that limited availability initially, we do believe that we will continue to get doses, not just in the first week, but in the second week and in the weeks and months to come. Phase 2 will begin when targets for phase 1 have been met, which will include factors including whether most of the target populations have been actually offered or at least made an opportunity to have a vaccine or to be vaccinated. Then expansion into phase 2 will include those workers, as I've mentioned, who work in those critical infrastructure settings such as in education, transit, utility workers, and others. Our vaccination efforts will continue until all Marylanders are able to access vaccines. As noted, Maryland will align with federal recommendations as much as possible. So we have now received word from the CDC that the state will receive approximately 155,000 initial doses from both Pfizer and Moderna. Pfizer, we anticipate we will be getting 50,000, a little over 50,000 doses, and because Pfizer will likely be the first vaccine to be approved, those will be able to come into the state and be utilized first. Moderna has provided 104,000 for the state of Maryland in the first allocation, and that will come to the state once that EUA is approved. Now, based on the considerations that we have discussed, the state has decided to divide our initial allocations among the groups that have the highest risk that we have seen in the state, to start with hospital-based healthcare workers and nursing home staff and residents. These are only the first doses that we will receive, and that more will continue to come week after week and provide those. We will be able to provide those to hospitals and to nursing homes. Of note, with the long-term care facilities, including nursing homes and assisted livings, the state of Maryland has signed up for the CDC's pharmacy program, which is a partnership that the federal government has contracted with CVS and Walgreens to be able to administer vaccines in those settings. And so we are engaging with both of them to make sure that our efforts are coordinated. And in fact, all nursing homes and assisted livings have been signed up on their behalf. They have the option to opt out, but we would certainly encourage all of them to participate in the program so that there is the workforce available to actually administer vaccines in their setting, again, to the highest risk individuals there. As vaccine becomes more available, we will follow our allocation and distribution plans and begin to distribute to local health departments, who will be able to make the vaccine available for first responders and others going forward. I would now like to ask Brian to come back up and discuss some of the logistics of vaccine ordering and distribution.
Thank you, Dr. Chan. In terms of ordering vaccines, we'll be using Immunet Now, Immunet is the cornerstone of Maryland's immunization information system. Providers will place orders in Immunet. It will go to the federal government, and the federal government will then distribute those vaccine doses directly to the providers. Immunet is also used to store vaccine records. Immunet is HIPAA compliant and is used to safely and securely manage personal health information associated with vaccines and immunizations. Immunet has been used in Maryland for over 15 years and is currently used to store every record of vaccines administered in Maryland. We'll be using it for COVID, but we also use it for non-COVID. We have recently enhanced the capabilities and capacity of Immunet to handle the additional information expected with the COVID pandemic. Now, we've talked about storing the record, but let's say someone wants their own record. Can they get it? The answer to that is yes. We have established a consumer access portal. An individual who has been administered a vaccine, even currently, can go to md.myir.net and download their own vaccination record. So we've talked about storing records, but let's talk about storing the vaccine, because I know there's been a lot of questions about that. As many of you know, the vaccines will come frozen. Many of you may not know that, but they will come to us shipped frozen. The Pfizer vaccine comes shipped at minus 80 degrees Celsius. This is considered ultra-low cold temperature. Moderna will be shipped at minus 20 degrees Celsius. Now, most providers of vaccines already have the ability to store vaccines at minus 20 degrees, so that leaves the minus 80 degrees Celsius. To make sure the Pfizer vaccines remain frozen at negative 80 degrees Celsius, Pfizer has created specially designed insulated containers, as you can see in this picture. It looks like a shipping container. In that shipping container is insulation and dry ice with the vaccines, and then dry ice on top. It's about the size of a suitcase and weighs about 70 pounds. It is GPS tracked, and the temperature is constantly monitored. Dry ice can be reloaded to assure that it has the correct temperature. If we wish to store it in these shipping containers, they can last for weeks as long as we continue to reload the dry ice. If we do not want to use these containers to store them in, they would have to be stored in freezers specifically designed for ultra-low cold temperature. As you can see from the picture, this is an example of what one of those refrigerators looks like. The state has secured several of these freezers to ensure that we can store them. In addition to that, we have contracted with institutions, organizations that have ultra-low cold storage capabilities. And we've established contracts with multiple vendors with dry ice suppliers. We feel confident that we can handle the storing of the vaccines either in their shipping containers or in ultra-low cold storage. I'd like to move on to another concern that has been mentioned, which is vaccine confidence. The governor spoke about that he's willing to be one of the first to step up to take it. Well, we recognize there is vaccine hesitancy out there, and we are committed to hearing these concerns. The governor is committed to ongoing statewide communications that will be led by Governor Hogan. We will work on hyper-local outreach. We want to collaborate with the trusted community leaders and community voices to understand community hesitancy. We will communicate what we know and what we don't know. We will share safety information, such as side effects, in a language and style that is easily understandable. We feel that the best way to build confidence is open communication. Now, this comes with a caution. We are already aware that there are rumors, false theories, misinformation circulating on social media. We ask everyone to get their information from trusted sources that are based in facts and science. We know there are questions out there, and I'd like to invite Dr. Chan back up again to address some of the common questions that have already been raised.
Thank you again, Brian, for talking through some of the logistic aspects of our vaccination plan. And we know that there are many questions out there, and that you have questions as well. And so I want to address some of them that I know are front and center for healthcare workers and for our communities. And so one question is about the safety of the vaccine and whether there's potential side effects. And what we know from the vaccine trials, so Pfizer enrolled over 40,000 people, which is quite a large vaccination trial, and Moderna enrolled about 30,000 individuals with some significant effort to ensure diversity in the people that were enrolled, both in terms of age, race, and ethnicity. As I mentioned earlier, it appears that among all of those groups, and I believe FDA just released Pfizer's data earlier today, but we believe that the efficacy is consistent across different age groups as well as race and ethnic groups. However, side effects are important to understand, and so these vaccines, among the people who received the vaccine, they did receive or did experience some mild side effects, but most people did not. Some of the side effects that the people did experience were primarily in the first 1 to 2 days after receiving the vaccination, and some one might expect, including pain at the site of the injection, mild fever, headache, muscle aches, and joint aches as well. And this shows actually that the vaccine is working, that the body's immune system was responding to the vaccine to be able to produce those protective antibodies that would ultimately protect that individual against getting the disease itself. Another important aspect of vaccine trials is that there are independent groups that are monitoring the results at every step of the way. And for both Pfizer and Moderna, their data monitoring committees, is what they call them, did not flag any safety concerns throughout the course of the vaccine trials to date, and they will continue to monitor the follow-up of the individuals who've enrolled in the vaccine trials for at least another couple of years. And so that's important to understand. We know that the early information about side effects, that about 10 to 15% of people, at least in early reports, may experience mild to moderate impacts, again, back to the pain at the site of injection and some headache and fever and muscle or joint aches. Another question that people have asked is the vaccine safe for children? And that's a really good question. Right now, the vaccine trials have only been done and have only enrolled adults. And so it is anticipated that any EUA approval or recommendations from the CDC will only be for adults at this time. However, the clinical trials have already started to enroll children as young as 12 and will be also enrolling even younger children. So we anticipate that the results from future trials will provide us more insight on the efficacy and safety in children. Another question that has come up is, will I need to be vaccinated every year? And at this point, we do not know how long the immunity will last. There is some who suggest that there may be a need to get a vaccine or a booster similar to flu vaccine once a year. But at this time, we do not know whether or not that will be necessary. Again, as we follow the individuals who were part of the vaccine trial, we'll be able to have more information and provide those answers to you. Another question is, will I need to keep wearing a mask after I get vaccinated or keep social distancing? And I know that's front and center on everybody's mind. And the vaccine, from what we know so far, is that it will protect the person who's getting vaccinated from getting the disease. But it is still important, and we believe that it will still be important for everyone to wear a mask and practice safe social distancing and hand washing to prevent potential transfer or spread of disease to people who are unvaccinated. And then, when can I pre-register for the vaccine? So I know many Marylanders are ready to get the vaccine and want to learn more information about the vaccine. And in the coming weeks, we will be rolling out more information as well as a mechanism for Marylanders to actually pre-register and even then sign up for an appointment. And again, as we move into phases 2 and 3, we'll be able to have that available for all Marylanders. So I know that there's many other questions, and we commit to continuing to provide Maryland with updates. So thank you, and I will turn it back to you, Governor.
Well, thank you both. We'll open it up to questions of any of the experts. Hopefully they'll answer the hard ones. I'll answer some easy ones.
How do you still convince some residents, especially African Americans, who look at the history of vaccines and still have that bit of untrustworthiness to take?
Yeah, I totally understand the fact that there are a lot of people out there that don't trust it, and I think I think it was Dr. Shan, you mentioned about or maybe it was you, I'm not sure who said it, Brian, about we're going to engage at a micro local level community leaders and people that will help maybe convince others that it is safe. So we're going to be doing it ourselves, but we're going to engage people in every community to try to help with that convincing, because we've got to convince folks to do it, or we're not going to be able to stop the spread.
Governor, I just want to follow up on a question I asked last week. You promised you have an answer today. The doses that are on the way, the initial shipment, is that individual doses, or is that enough doses to have that 155,000 immunization?
That's a great question, and the answer is the 155,000 doses are the initial allocation, and the federal government is holding back the second batch of those 155,000. So it won't impact, it's not half of the 150,000 and we have to hold them. We'll get the first batch, we'll get the second batch later, and the additional capacity to do additional people.
So so it's one shot of the 2 shots needed? So
Yes, we get one shot of the 2 shots needed, and the federal government is holding back the second shot, which we will get within the time frame that they need to get the second shot.
Are you confident you'll get them, given some of the headlines in the news?
We've had assurances from everybody at the federal level in Operation Warp Speed, and so far they're ahead of schedule and everything, so I'm hoping that will continue.
Thank you.
Following up on Bill's question a little bit, can you describe your level of comfort with this vaccine? I've been doing story after story, I've heard the same things in the community. I talked to a leader of one of the hospitals who said his own staff is concerned. I kind of look at, describe your personal level of comfort.
Well, look, we have an incredible process here in the country, and I can assure you that all the people who know it a lot better than I do have done quite a bit of studying, and they all believe that it's safe. I've had conversations with all the leaders, as I mentioned, in the Coronavirus Task Force, and Dr. Fauci and Dr. Birx and Robert Redfield from the CDC, and everybody involved believes that it's safe and very effective, more effective than almost any other vaccine in history. And that's going to help us save a lot of lives. So I don't have any hesitation at all.
And one quick follow-up since we started that. Look, so 155, there's 6 million Marylanders, we're shooting for 70% immunization. Do you have any sort of timeline down the road where we're going to get these phase 3 people done?
So as what we think is we're going to get maybe 300,000 by the end of the month. Which is pretty fast, so they'll continue to come out every week if things go according to plan. We have about that many frontline healthcare workers, so it's still going to be limited to that 1A group that, as they were describing, the pyramid. But the production will ramp up for both Moderna and Pfizer, but we also have these numerous other companies that are getting close to having their vaccines available. So the hope is that we'll have similar success with some of the other companies, including the ones I mentioned here in Maryland, with AstraZeneca and Johnson & Johnson working together with Emergent Biosolutions, with perhaps Novavax in Montgomery County and others, so that we'll have a growing supply coming from different places, different manufacturers. Hold on one second. He was already talking here.
Governor, obviously, to build public confidence in it is
attend school. Would you be in favor of any requirement that either state employees have to receive the COVID vaccine, or add this to the list of vaccinations that school children have to have before they start?
Well, maybe that's something Dr. Sham might want to address, but we don't have any intention of requiring these vaccines, but we're going to do everything we can to encourage. And I don't know if you want to talk about kids in schools.
Thank you for that question. And as I mentioned in my remarks, the clinical trials right now are just beginning and underway for children. So we have very little information right now, or no information about what the efficacy and or side effects for children will be. So when that time, and also I guess the other important component is that the vaccines will be approved under an emergency use authorization, which has the same rigorous look at all of the data as through a normal process, but because we are in a state of emergency and because we have individuals being hospitalized and dying from COVID-19, this is a very expedited review process. So I think down the road, there may be considerations for that, but it would be premature right now to make that mandatory in school children or others.
If I can follow up with you since we're on this subject, the superintendent of schools, Dr. Karen Salmon, has told the State Board of Education that she does not believe schools that have reopened are super spreader locations. Do you agree with that assessment?
So Dr. Salmon and I communicate on a very regular basis. We call and each other every single week to talk about how the pandemic is evolving and the impact on schools and school children. The guidance that we issued back in August, we are looking at new information that's coming out to assess whether or not there may be any need for changes. However, the other question is about how locals are interpreting that guidance, and I believe that within certain settings there may still be an opportunity to bring children back in small, limited, small groups, for example, and particularly children who have had more difficulties with virtual learning or those who have special needs.
Dr. Chan, could you talk about the pyramid, the 1A, how many people are in that group and how many people will the vaccine sort of cover?
So I believe, if I remember correctly, and I think it's around 800,000 in the 1A population. We believe that is the case. And so we are going to, as we get vaccine, we will start, as we said, with the highest risk, so within hospital settings, the staff there, and then in nursing homes. And then as we get more vaccine, so as we complete the vaccination of those groups of individuals and we get more vaccine, we will be able to expand the number of people and the groups that are able to access the vaccine with assisted livings, with other healthcare providers, including in outpatient settings and first responders. And so we're going to move as quickly as we can through each of the priority groups so that we ensure that all healthcare workers have the opportunity to be vaccinated.
Doctor, can you explain how population density and different jurisdictions of the state could play into how vaccines are distributed?
Absolutely. So, there's various considerations in terms of how we begin to allocate vaccine to different groups. And so certainly a number of people, it doesn't make sense to give a Montgomery County or a Baltimore County fewer doses than a county out in Western Maryland, for example. And so those are absolutely some of the considerations. But some of it will be dependent also on the logistics involved. As you heard from Brian, that the Pfizer vaccine requires the ultra-cold storage and very, very careful handling. And so that will also be a consideration about who can manage it and who can handle the types of vaccine that will be available. Again, these are only the first two that we know of, and we have a lot more information about these than the others that are currently in phase 3 or in earlier phases of trials.
Dr. King, in terms of the general public, the not high-risk folks, the folks last in line, how is it contemplated that they would receive their vaccines? Through their provider, going to a pharmacist, or would we have come through state-run clinics that we have testing?
That's a great question. And so in the early phases, we are directing our vaccine to facilities primarily, and also working very closely with local health departments who have had, years of experience in doing vaccination clinics. Some of them have done mass vaccination clinics for many years. So the process is similar in that way. However, as we receive more vaccines, we will be opening up in the coming weeks the registration portal for providers in Immunet to be able to register to be able to order and receive COVID-19 vaccine. And so those providers will include pharmacists, primary care providers, FQHCs, urgent cares, and others. And so ultimately, the goal when we are able to reach phase 3 is that we have sufficient vaccine of potentially multiple different kinds that providers can then put in an order in Immunet, and that we can then be able to fulfill that order, submit that to CDC, and then the vaccine would be sent directly to them. And so that's how Marylanders will be able to access vaccine.
Dr. Chen, I know that you guys are establishing an online portal. A lot of states are also doing a paper record is the state also going to be doing that for people who don't have access online to keep track of their vaccines?
Correct. Each of the vaccine kits that are coming from the manufacturer and through CDC will actually come with a paper record as well. It is important for people to know, and Brian alluded to this in his remarks, that through Immunet and through MyIR are the critical pieces where we will be able to keep track of who got which vaccine, because right now with 2 vaccines potentially coming down that we will be able to administer, we want to be sure that individuals keep up with which vaccine they were administered. And so I think that's a critical point to emphasize, that both of these vaccines require 2 doses, and the second dose, Pfizer, will be about 21 days later, and the Moderna vaccine will be about a month or 28 days later, and they need to receive the same second dose as they received the first time around. So second dose notifications and reminders will be really important as well.
Dr. Chen, do you have any reason to believe that this could go faster or slower than the timeline you've put out there? Could there be bumps in the road as far as this is all concerned, or do we not know that?
Well, I think that as any good planner would say, is that you prepare for the worst, but you hope for the best, and we are prepared for both eventualities or possibilities, in that we have our providers ready, and local health departments are working furiously to finalize their plans. And, we know from our experience with H1N1 that the supply can be 1 week you might get as much as you ordered, and the next week it might not be. And so we are expecting that, although it's hard to say at this point in time what the actuality will be. So we'll see when the time comes, but we have to expect that. And that's what we're informing our providers, is that, even though everyone wants a certain amount of vaccine, that we will provide that amount, but it may not be exactly the first week, but we will provide vaccine as we get it. It is not our role and not our goal to keep any vaccine. We want to get it out there and get people vaccinated.
Governor, can I ask you a question about hospitalization? Sure. You began talking about dark days ahead, and we understand there was a White House COVID task force report that said Maryland is #1 in the country for hospital admissions. Governor, this is all good news and it's hope. But how clear do people have to be about what's going on in our hospitals right now, and how much worse this could get between now and when we start these phases?
So I didn't see that report, but I don't think it's accurate, because I've already talked with other governors who have far more hospitalizations going on, and many of them that are way over 100% capacity. So I don't know what the report was. But yes, we're concerned that, and I mentioned this in our last 2 press conferences, that we anticipated that we were going to hit peak hospitalizations. I said in a matter of days. We now have, almost in the same time frame. We still don't believe we're at the peak. We think that's coming in the weeks and potentially months ahead. As we get into, we got to get about 3.5 weeks away from Thanksgiving, so it'll get worse next week. We anticipate all the modeling shows all of December and January looks pretty rough, which is why we've put so much emphasis on hiring additional healthcare personnel, recruiting more people with the skills to take care of people, and building 6,000 extra hospital beds. But, you know, as I mentioned earlier, we're on almost every category, we're one of the best in the country.
Governor, I wanted to circle back to the number of vaccines because we're hearing that Pfizer could be filling requests for other countries after the United States. Is Maryland prepared to independently buy COVID vaccines?
No, I think, look, I don't know what happened, and I saw the report about, you know, the federal government passed on the opportunity to buy $300 million and bought $100 million. I don't know any of the details of that. I think as they're going through these things before purchasing, they want to make sure that they were going to work or be effective. But, you know, I think we're seeing great ramp up of production with these two companies and numerous other companies getting close. So hopefully there'll be enough to go around. But obviously these are, you know, it's a very short supply on things that are desperately needed all over the world.
Just to piggyback on Tom's question, just wondering whether you're considering, given that there are dark days ahead, are you considering taking action on like another stay-at-home order? And if not, why not? What would have to happen for you to do that?
Well, we continue to look at the metrics every single day, and we're looking at the data about where the infections are coming from and what actions might help stop them. And so far, we've taken all the actions that we believe should be taken at this point, but there obviously may have to be additional actions as we progress and when we get to that point where we've you know, maxed out our hospital capacity. But we're trying to balance saving lives and keeping people safe with also looking at the thousands of businesses that are closing and the hundreds of thousands of people that are unemployed. And so we're trying to balance the both health and economic crisis.
Governor, last time you were here, you talked about
We'll get back to you, Kate.
you talked about the lobbying you have been doing on behalf of the coronavirus relief measures. Since then, what lobbying have you done the past 2 days? Who did you call today to get that money passed into the hands of the states?
Well, yesterday I recruited a group of Republican governors to call their Republican senators. I've been in communication with Senator Warner, who's been taking the lead. I've spoken with Senator Manchin and Senator Warner, who are a big part of the Problem Solvers Caucus, which I've been involved in through No Labels. I've spoken to them 4 or 5 times. But they're part of that Problem Solvers Caucus. It's 25 Republicans and 25 Democrats who have proposed a bipartisan compromise, and I'm, you know, rounding up governors and trying to weigh in with senators. We've contacted our delegation to try to get them behind it. You know, we still have this Republicans saying this and Democrats saying that, but there is a pretty good consensus of people that just, you know, we can't get what everyone wants, but something is better than nothing, because in a matter of weeks, we're going to have no more money to help anyone. You know, they have to take action. So the current compromise will really only take us till March. It's like a 90-day Band-Aid. We're going to have to come back to get the major relief packages that we've been pushing since April through the National Governors Association.
Last question, Kate. Sorry, I just wanted to follow up with Dr. Tanner Bryan. I talked to you about this last week. What will this look like for the regular people, for the rest of us? When I talked to you last week, Brian, you said...
I think we let Brian come up and answer one.
You said we'll see kind of like a potpourri of everything, but Dr. Chan, you just made it sound like it's going to be the way you get a flu shot. You go to a pharmacy, your physician, or maybe to your local jurisdiction. Will we see state clinics that like the test sites and that sort of thing, or is it really going to look like flu shots?
So we had talked about that pyramid and that graduated progression through the phases. So initially, the vaccines will be going to very specific locations, hospitals, nursing homes, the pharmacy, CVS, and Walgreens will be getting them to support all of our long-term care. As that expands, we'll be getting local health departments will have access to the vaccine to start, again, hitting more of that level 1A, 1B level, and it continues to spread out. And what Dr. Chan said is exactly where we hope it to be in the long run. Is it'll be at your pharmacy, it'll be at your doctor's office. That's where we want it to be in the end. But we have to go through those steps. And as vaccines become more and more available, it spreads out faster and faster. So, well, the local health departments will certainly be running clinics and be part of this process. Absolutely.
Okay, thanks.
So.
That makes sense. Thank you.
Thank you.
Thank you, everyone.
Thank you. Great job, Joe. Thank you.